Now go into the histology of the spleen, or how they appear under the microscope. So the spleen is also an encapsulated organ made up of fibroelastic connective tissue. So specifically, we have the collagen fibers, elastic fibers with smooth muscle fibers. And inside the spleen are also splenic nodules. And what are found in the splenic nodules are arterioles representing the white pulp or the typical lymphoid tissue, and it has also a lighter area we call the germinal center. So we can see here the appearance of the spleen microscopically, so similar to that of the other lymphoid organs and structure, with a darker area and lighter area, the presence of nodules inside the spleen. And what is very specific in the splenic nodules are the presence of the red pulp and the presence of the white pulp. So take note, red and white pulp in the spleen. The white pulp contains the pulse. So pulse are the periarterial lymphoid sheath about the arteries. So the arteries in the spleen are surrounded by a lymphoid sheath we call the pulse, periarterial lymphoid sheath. This is a clearer microscopic appearance of the lymphoid tissue or the spleen. So we have here the pulse at the center. These are the arterioles which are surrounded by a lymphoid sheath, and we have the darker structure, we have the lymphocytes. So we call this as part of the spleen as the white pulp. And towards the right side are the appearance of the red pulp. So the red pulp is considered to be the atypical lymphoid tissue. It consists of the following: Billroth cords or splenic cords or pulp cords. These are strands of reticular fibers heavily infiltrated with blood cells. This slide gives us the difference between the white pulp and the red pulp. So the white pulp contains the lymphoid tissue, while the red pulp does not contain the lymphoid tissue. It is just red in appearance because of the blood cells present. The spleen also contains numerous small venous sinuses lined by littoral cells, as shown in the illustration. The littoral cells are unusual shaped endothelial cells, phagocytic in function, specifically in littoral cell angioma or vascular tumor of the spleen. From the encapsulated structures and organs, we go now into the partially encapsulated lymphoid structures. We have the tonsils. The tonsils are collections or aggregations of lymph nodules in the tunica propria of the oral cavity and pharynx. They help to prevent respiratory and gastrointestinal infection. Three important tonsils in the body. So we have tonsillar tissue in the nasopharynx and oropharynx. So we have the pharyngeal tonsils or adenoids. We have the palatine tonsil and the lingual tonsil. The three tonsils form a ring, and this is referred to as the ring of Waldeyer. So we have the pharyngeal tonsil on the uppermost part, the palatine tonsil on both sides, and we have the lingual tonsil at the bottom. The pharyngeal tonsils are the adenoids. So you can see here in the illustration the palatine tonsils on both sides, and under the tongue we have the lingual tonsils. The histological characteristics of tonsils are: they are lined by stratified squamous epithelium or non-keratinizing type of epithelium or moist epithelium. As seen in the illustration, presence of tonsillar crypts, presence of salivary corpuscles, these are the nodules in the lamina propria of the tonsil, although there are no lymph and blood sinuses, but the tonsils are highly vascularized. There is a partially capsule present. This is a thin capsule delimiting the tonsil from the surrounding loose areolar connective tissue. We have here the microscopic appearance of the tonsil. So just like the other structures and organs, it has also a darker area, the cortex, and a paler area. We have the germinal centers, and toward the center of the tonsil, we have the medulla. So the appearance is actually the same as that of the other organ and structures of the lymphatic system. So we have here the microscopic appearance of the palatine tonsil. It has the same appearance as that of the other lymphoid structures and organs. So the same lymphatic nodule with a darker area and a center which is a lighter area we call the germinal center. Then we have isolated lymph nodules we call solitary lymph nodules. So we have Peyer's patches in the small intestine. We have the mucus-associated lymphoid tissue or the mouth, and we have the gut-associated lymphoid tissue in the digestive system, and we have individual lymph nodules in connective tissues and different organ systems of the body. The Peyer's patches is an aggregation of abundant lymph nodules in the tunica propria of the small intestine. It is a patch or group of lymph nodules and credited to the Swiss anatomist Johann Conrad Peyer. So in the illustration, you can see the Peyer's patches underneath the surface epithelium. So the same appearance as that of the other lymph nodules. Microscopically, the Peyer's patches appear as oval or round lymphoid follicles, similar to lymph nodes located in the lamina propria layer of the mucosa and extending into the submucosa of the ileum, a part of the small intestine. The presence of the Peyer's patches is because the lumen of the gastrointestinal tract is exposed to the external environment. Much of it is populated with potentially pathogenic organisms. So the Peyer's patches establish their importance in the immune surveillance of the intestinal lumen to facilitate in the generation of the immune response within the mucosa and prevent the growth of pathogenic bacteria in the intestine. That ends up the first part or the first set of PowerPoints about the immune system. So the next topic will be on cellular components, and this is just a review.